So today we're going to talk a little bit about recovery expectations after total hip replacement surgery. Thank you, Jen, for joining us.
Thanks, Sarah.
So to start out, we'll talk a little bit about recovery expectations. All the anesthesia that you're going to be receiving at the surgery center will wear out of your system anywhere between kind of 12 to 36 hours or so you may have an increase in pain thereafter. That's normal. That's where the pain medications that we'll talk about after the video will come into play. Also, you should know that it is very common to experience bruising. Bruising will go into the lower leg, so into the knee, so don't be alarmed if you have knee bruising. That's just from the surgery hip. Also, you're going to have some swelling. Swelling will peak around 2 weeks. It does extend into the knee as well, so again, don't be alarmed about that.
What about numbness?
Numbness is very common after a total hip replacement. It will extend a good portion of the outside of the thigh. It's going to take several months to fully resolve, and it does regress back up to the actual incision line. So again, don't be alarmed about that.
Speaking of the incision, what should I do for care?
So the dressing is going to be waterproof, so you're going to be able to shower even the night after surgery. The dressing should remain in place for a total of 2 weeks. We see you back at the 2-week mark to get x-rays, see how you're doing, and then remove the dressing. It is important to note that if the dressing for some reason becomes halfway saturated with either blood or any other discharge, give us a call. We'll have you come in for a dressing change sooner.
When else should I call the office?
Good question. So again, we are always here, so if you have any questions or concerns, just give us a call. Reasons though to definitely give us a call are if you are suddenly unable to bear weight on that leg, fever above 101, severe pain, significant nausea and vomiting. Again, give us a call.
How about activity?
For the first 2 weeks, all we have you do is walk. You're going to start initially with a walker that the surgery center will give you. You'll progress from a walker to a cane to without anything, completely at your own speed. In terms of walking, we want you to walk about 15 to 20 minutes, 2 to 3 times a day, increasing your tolerance as you're able to.
So what about physical therapy?
For the first 2 weeks, all we want you to do is walk. That is your physical therapy. At the 2-week mark, we'll talk about if physical therapy is something we should integrate into your recovery plan. Not all patients require it, so it's a patient-specific determination.
And how about sleeping?
There's no specific requirement regarding sleeping position or what to avoid. We just ask that if you sleep on your side, put a pillow in between your legs so your knees are not touching. It's most common though to sleep on your back.
What about blood clot prevention?
There's several methods that we have to help prevent against blood clots after surgery. First is medication. So typically we prescribe aspirin 81 milligrams to take twice a day for 30 days after surgery. We couple that with Protonics just to help protect the stomach lining. This will be modified if you have a history of a blood clot, DVT, or a PE in the past, so let us know. This also will be modified if you are currently taking a blood thinner for any other reasons outside of aspirin. So again, that can be patient specific.
Perfect. What about the compression stockings?
Compression socks are another way to help reduce blood clots as well as reduce the swelling in the lower legs. We want you to wear it on the surgery leg for 4 weeks and on the non-surgical leg for 2 weeks. For a good 8 hours in a day. It does not have to be worn at night, and obviously while you are showering or if your legs need a breather, you can go ahead and remove it. We will also have you wear sequential compression devices. These are devices that the surgery center will give you. They are worn at your calves and inflate up and down to give your calves a little bit of a massage, with the purpose of circulating blood flow after surgery in your lower extremities. That is worn for the first 2 weeks on both legs, just at night.
Okay, what should I expect for my follow-up appointments?
So we see you back at several intervals after surgery. The first is that 2-week follow-up that I was previously talking about. There we get x-rays, see how you're doing, and then remove the dressing. Thereafter, we see you at the 6-week post-op time frame, 4 months, and then 1 year. At each of those visits, we're gonna check on how you're doing and then get updated x-rays.
And what if I have to have a dental visit?
For the first 3 months, we do want you to not have any dental cleanings or procedures. So keep that in mind in terms of scheduling purposes. After the 3 months, do have a discussion with our office as well as your dentist to determine if prophylactic antibiotics prior to dental procedures is required.
Perfect. And then should I call the office as needed?
So again, just as a gentle reminder, we're always here. So if you have any questions or concerns, this is a process, so give us a call. Reasons we definitely want to hear from you are if you were unable to bear weight on that leg, fever above 101, severe pain, significant nausea and vomiting. Again, we're here for you.
Okay. Thank you.
Thank you.